Hello. I feel that there has been a poop. And a pee. Okay. Stalled as long as I see you eating your snacks. Oh, I guess. Let's see, how are we going to do this? Hello, Skye. How are you? Did you give your cozy bed a bath? Did you give your bed a bath? Very beautiful. Very beautiful tonight. Do you want a little treat? You'd have a big meal since last we met. I made it for you. I wonder if I can get her with this blue blanket. Might require because that makes you nervous. Makes you a little bit nervous. I think you do it the normal way. You just do it the normal way? Alright, we'll do it the normal way. Making sure that I make lots of noise and get stuck on things. There we go. Ooh. Okay. Easy peasy. Maybe I could just make some room for myself over there. Possibly. So many cords that are all tangled up. Alright, let's get that out of the way. Okay. Alright, let's see if we can do that. Let's see if we can do your drops without having to undo your whole entire bed. Hi. You are such a good girl. I know, it's so, this is a weird angle for me. I know, this is probably, come on. Stand by. Malfunction. Bottle malfunction. Huh. Sorry. You're being so good. I know, human predator. Why is my bottle is not dispensing drops all of a sudden. I don't want it to go shooting into her eyeball. Tuna can. Okay, let's try this again. What on earth? I have to perform a procedure on the eye drop ball. What have we got? Sterile. Oh, perfect. Perfect. A sterile needle. That will do the job. Hopefully. Ooh. Weird. Okay, I think now. There we go. Okay, this time. Now it's working. Perfect. Sorry, third time's the charm, huh? I know you were so good the first two times. Perfect. We got one. There. Good. Okay. Drops are in. We've got 20 minutes to wait. So we just did our tiny suitcase packing and smuggler appreciation party. So all the smugglers got to say goodbye to Noelle and Elf. You're a good girl, aren't you? Oh, such a good girl. Such a good girl. Ask Tiger Buffy's people about the blackberry wine. They were the ones, they brought it in appreciation of smugglers. I can't remember offhand what it is called. Yeah, Savina must be getting pretty close, within a week, I think, of babies. The serum drops end tomorrow. The ointment continues. And we're waiting to hear back from a specialist how long we should continue the serum and if we should add in antiviral drops. The tissues can only absorb so many different medications, so trying to figure out the best combination to give her the best benefit. But like I said downstairs, there's not a lot of precedent for this kind of thing, so it's very, very specialized and also very theoretical to have them so advanced and such chronic ulcers that are so advanced. So we'll see. We'll see. You're so good, girl. She's such a good girl. She had a good snack and a poop. No, I'm not related to the Roche winery. No. It's hard to tell if there's improvement. I've been taking pictures just to see if the size of the scarring is visibly changing, especially in her right eye, but the lighting and the angle makes such a big difference that it can look better one day and then look worse the next day. It's definitely not getting worse, I can tell you that much. But beyond that, I imagine, I mean, her conjunctiva looks better. And she seems to be fairly comfortable. She's not digging in her eyes. She's not hiding from the light. Those are all pretty good signs, but it's very hard to tell. And I don't know how long it takes. I've seen, there's just not a lot of information about this advanced of a chronic ulcer situation, but I've seen some people have commented that they've had cats with corneal ulcers that took months to treat, but they, you know, they got much improved. So we'll just have to see. And then we'll see after babies if there's a surgical option or anything else that might be able to be done to improve some of the scarring. But the first step is just to try treating it and see what happens. Oh, a big sigh. That's a big sigh. Skye has done remarkably well. I didn't try to interact with Sloane or Cisco at all. Neelix, I don't think would have come around like this if I had been interacting with her 3 times a day. I'm not sure about Sable. Savina definitely, she's come a long way. She's doing really well now compared to where she was. Like, you can see when she's on the screen how relaxed she is. Like, she's like sitting like a little, she's really cute right now. I'll show you what she's doing right now. So she's very happy, but I think she's that calm because I only go in there once or twice a day to bring new food and clean up and do litter boxes. I don't try to force myself on her because the priority with her is just trying to give the babies the best possible chance, which means keeping stress as low as possible and giving her the best chance to be able to take care of them, hopefully. Camera doesn't know we're supposed to focus on the adorable cat. There, that's better maybe. So Skye has responded. I also don't know if it's something about being injured, because Mistletoe and Skye and Hollybell and, well, not Fairy though. But I didn't have to do daily treatment for Fairy after the first couple of days, so it's hard to say if it's just I got super lucky with her personality, or if there's something about being vulnerable and injured and getting help and having that forced interaction 3 times a day. I'm sure these are things that we'll continue to learn. But so far every mama cat's been different. Yes, Neelix has gone into her new nest. She was there when I came up. I'm not sure. Let's see if she's still there now. I forget sometimes you guys can't see all the cameras. Nope, she's not there now. I'm not sure if she's in nest avoidance mode. She's been hanging out under the Karanda Tower where it's cool on the wood floor, which is a late stage pregnancy trick that most pregnant cats will do. But it did also happen about the same time I changed the bedding. However, she has been in there now several times, and she has been going in there to eat her snack. So I suspect she will go in there when it's time. Savina has the best camera setup in her nest, but I'm not 100% sure I'm going to show her birth, but just because I'm a little nervous if it's her first time, and I definitely won't be able to intervene with her. I think there's a slight possibility I might be able to interfere if Skye's got really in trouble, but I don't know. It's probably a very small chance. She did hiss at me earlier today when I came in. She is still definitely fearful of me. This only happens because I approach her in the least threatening way possible, and I think the blanket trap prototype contraption thingy that I rigged really is helpful in reducing the threat that she senses. Because when it's just her and me in the room, and I try to approach her, and she doesn't feel nearly as safe. So that's been kind of interesting. He's so cute. Sloane is not currently a candidate for adoption, no, but I did actually try to trap her maybe like 2 months ago. When things were sort of slowing down around here, I tried to trap her for like a week, and she was having none of it. She doesn't let us pet her, really. Like, we can kind of touch her quickly, but she's definitely curious, and she follows us around. She's interested, but she does not welcome interaction. So I think possibly we could bring her back in and try her again if there was ever an opportunity to do that, but I think she would take a lot of work, and I don't know if she would ever be happy. Yeah, Sloane does like to talk to us. She talks us through the feeding station routine. Yeah, Neelix did okay in the blanket, but she never, she was always pretty nervous, and you can see when I can see, as soon as she hears me at the door, her eyes go full on, like perfectly round, giant pupils, and that's not super surprising to me because she was always very skittish at the feeding station. I don't know about upgrading from the Cabinet of Solitude. I think that would be pretty stressful for Sable, and So they may be in there for a while, I don't know. And Sable will move them if she thinks that they need a bigger space. But I think they may be in there for a while because they're contained and she feels safe in there and she's taking good care of them. So even though, like, if it was normal kittens, probably maybe around like 3 or 4 weeks, I would usually expand the space a little bit, but I think it's probably best to not mess with it too much. Sable will get quite a workout picking them up. I haven't actually seen her pick them up at all yet. She did try, like, or she sort of made like a half-hearted attempt. Oh, like a big stretch? Yeah, there's a big stretch. I can give you that option. So you're very smooth right now. I'm going to pet you like this. I'm going to pet you like this. You like it. You like it. Oh, Skye nut. Oh, you like it. Such a good girl. Such a good girl. Oh, good purr. Those are good Sable purrs. That is purring, yes. She's purring. She purrs. Oh, look at that little face. It's so cute. Look at its little face. Oh, it's so wonderful. Look at that. Look at her neck. Oh, it's nice. Oh, it's so cute. Oh, it's like He's so cute. So cute. He's so cute. Oh, he's so cute. See, I don't even remember that this year. You're not acting like you're supposed to. No. Guess what it's time for now? Where is it? Somewhere. Right up. Right before ointment time. Yep, I think there's a lot of potential here for sure. We may have to take a break while she's raising her babies, but good girl. I think there's enough potential to make it worth. Oh, you're so cute. I'm sorry. To make it worth keeping her around if she does regress when the baby's home. Pretty. Keeping her around afterwards to try to make some progress with her. And then hopefully, of course, we can find a home that understands. Oh, we have so many wonderful feral adopters now. That's what we need, someone who understands where she came from and what she's been through, and will give her all the medical care she needs and all the love she needs, and be patient with her. I suspect she would be okay with other cats. She's very good. Or maybe she could go home with a baby or two. Who knows? I mean, she's got lots of potential. So, on that note, I'm going to try to make her bed. I've still got one more round of physical therapy to do on the casserole. And it's been another pretty long day. Lots going on. Very eventful. Alright. She's laying on the blanket. There we go. Oops. Oh gosh. Okay. And here we go. Whoops. Oh, I just pushed. Just covered up the camera again. Okay. Hi. You do pretty. Alright, very good. Okay, all cozy tonight. amount of night lighting. Okay. Very good. Is our Skye cam good? It's pretty good. Okay. And we've got food and fresh water and toys and a clean litter box, and I think that's good. Okay, so tomorrow's going to be another big day. Noelle's going home. I haven't done any of the adoption paperwork yet, so I need to do that before I go. So I better get to work. And then I've got to do casserole therapy.